Hello. Thank you so much to Lupus of Northern California for having me today. I am so excited to jump right into fueling your body with festive foods and working on your winter wellness. So it is probably everyone's inclination to eat all sorts of comfort foods, maybe heavier foods than normal, but we can still have comfort foods that help our lupus symptoms, that help reduce inflammation. So welcome. Thank you so much for having me. Let's jump right in. So this disclaimer is important for everyone to keep in mind. The information in this webinar is for educational purposes only. It is not meant to diagnose or treat medical conditions or replace your usual medical care. Always consult your healthcare practitioner for the most appropriate individualized medical care before making any lifestyle or nutritional changes. So what are we going to cover today? First of all, the topic is winter wellness, fuel your body with festive foods. I will introduce the topic and myself. We will cover Lupus 101 for all of those that are newly diagnosed, or even for people that have been diagnosed for a while. It's always a great refresher. Nutrition basics, dietary do's and don'ts, next steps. We will also cover some seasonally appropriate foods, as well as some fun recipes. So who am I? My name is Tanya Freirich. I am a registered dietitian. This has been my passion for my entire professional career. So all those letters after my name mean that I have done my master's in nutrition, and I am licensed and certified in many places to provide dietetic information, nutrition education, and I am so excited to be here today to share what I know with you all. I also have more than a decade of experience providing nutrition counseling, one-on-one and in groups. I absolutely love the ability to have other people understand this information so that they can implement it in their own lives and feel better. I am also a lupus warrior. So I was diagnosed with lupus more than a decade ago. And in my own life, the dietary and lifestyle changes that I have made an incredible difference in my lupus symptoms and flares. I feel so much better because of my diet and lifestyle choices. And I love advocating for other people, donating for research, and being part of lupus organizations worldwide. And I absolutely love empowering others to make changes. So you have control 3 times a day, 5 times a day to choose what you're eating. And if we can make some of those changes to be more positive, you can already feel the benefit. So quick review. What are the types of lupus? We are going to focus mostly on the first two, which is systemic lupus erythematosus and cutaneous lupus, which includes discoid lupus. These two types of lupus, when we reduce our inflammation, then we have less symptoms and less flares. Now, drug-induced lupus is, as the name says, a type of lupus that is induced by a medication. Usually, it resolves when that medication is taken away. And then neonatal lupus is a short-term lupus that the infant of someone with lupus may have for also a short term. So we're going to focus on those two first ones. What are the causes of lupus? Lupus, it can be confusing. It can also be called the great imitator because its symptoms overlap with so many other autoimmune diseases. And where does it come from? So many people feel very overwhelmed and confused about why their lupus has developed. It especially hits mostly young women from the ages of 15 to 49 are the age group that is diagnosed. And prior to having lupus may have felt very healthy. So it's an interplay of all three. You have your genetics, your environment, and your hormones. The question is with the hormones, and perhaps the answer of why this affects women so much more than men. 9 out of 10 people with lupus are women. There's also an increased risk of flare and disease activity during menstruation, pregnancy, and postpartum. Environment, that could be infection, injury, trauma, or stress. And maybe that's not a standalone cause of lupus, but in addition to a genetic propensity for it, you have these pieces that come together and then suddenly it turns into a lupus diagnosis. And so genetics isn't telling the whole story either. So for someone with lupus, your child has a 1 to 5% risk of developing it. If you have someone in your family, your risk may be 5 to 13%. And then your risk of lupus, if you have an identical twin with lupus, is 50%. So if it was completely genetics, you and your identical twin would have 100% risk. You would be exactly the same because you're identical twins. You have the same genetics. However, it's not. Let's continue on to the symptoms of lupus. So this list includes so many different organ systems, and this is what can be so confusing about lupus. It may include extreme fatigue, pain or swelling in the joints, swelling in the hands, feet, or around eyes, especially when lupus is affecting our kidneys, Raynaud's syndrome, headaches, low fevers, sensitivity to sunlight or fluorescent light, UV light, chest pain when breathing deeply, brain fog, abdominal pain, nausea, vomiting. A lot of people don't realize that that can coincide with their lupus. Rashes, whether it's the malar rash, the butterfly rash on your face, or other parts of your body. And then you see a whole list of other symptoms. It can cause cognitive dysfunction, seizures, depression, anxiety. Also, in addition to the rashes, we can have hair loss. Pleuritis, it feels like very intense chest pain, and then also mouth ulcers or ulcers in your nose. So the leading causes of death with lupus, and I don't want to put our focus on the scary parts of lupus, and don't worry, the rest of the presentation is all about what we can do proactively, the positive parts, the reasons for hope with lupus. But I want everyone to understand why these things are so important. So unfortunately, for those living with lupus, we have 2 to 4 times the risk of death from cardiovascular disease. We have an increased risk for fatal infections and kidney failure. These things are things that we can work to prevent, that we can minimize our risk for when you change your diet and lifestyle. So how can we live longer and healthier? First and foremost, see your doctors regularly. Focus on dietary changes. Incorporate more movement, stress reduction, adequate sleep, and your environment. So please, 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 if you feel like you don't have a great relationship with your doctor, they're not listening to you, perhaps get a second opinion. Advocate to see someone else because that relationship is incredibly important. And when you're not feeling right and perhaps your doctor isn't really regarding your symptoms or your complaints with seriousness, with approach to really deal with those, that can be really frustrating and lead you to disengage from talking with your doctor, and they may miss something that's very important. Incorporating more movement can feel really hard when you're having a lot of joint pain and swelling. And so that's when I really encourage people to be very gentle with their movement, maybe go on a short walk, maybe do some stretching at home, but that movement still counts. Adequate sleep. So a lot of times people feel as though sleep is being lazy or, oh, I'm oversleeping, I'm not doing anything for my health. But that rest can be really, really helpful in reducing your inflammation. So when you are having days that you feel good, please don't continue to push yourself further and further and further. That sleep deprivation can increase your inflammation. So when we think of making changes, I do want you to consider your whole person, your whole body, your whole life, because that 360-degree view really gives us the clues to where we can improve things. Nutrition obviously is a huge, huge part of this. Dietary triggers, helpful food intake will make a world of a difference. But also movement is very important for our cardiovascular health, preventing osteoporosis due to long-term steroid use. For example, prednisone, we know it's not great for our bone density. So when we can be mindful of these things and include movement, we're doing great to make sure that we feel good now and for the long-term future. Mental health. So stress management, coping with a chronic illness is incredibly difficult, especially if the next section, you don't have support. You don't have friends, family, support groups, medical providers. Then your mental health can suffer when you feel isolated and alone. So please, many people feel as though they don't want to talk about their lupus. They just put it in the kind of a closet and of their mind and put it away. However, when you talk about it, express your difficulties, you'd be surprised at how many people in your community want to support you and can be really helpful, or at least just a shoulder to lean on. And last thing, your environment. So reduce your exposure to pollutants, chemicals, stop smoking if you're a smoker, include less alcohol in your day or in your week. All of that can help with reducing inflammation. So, where do we start with nutrition? Today, we'll talk about balanced meals and plates, heart healthy nutrition, reading nutrition labels, reducing inflammation, and increasing your nutritional content. So here are some examples of healthy plates. And you notice here, I am including examples with cuisines from all over the world, different cultural foods, because there is no one way to do this. There is proportions that I would love for everyone to aim for. So 50% of the plate. If we can get that filled with vegetables, that's going to be incredibly beneficial. However, those vegetables can be one of hundreds of types of vegetables. There's so many fantastic vegetables out there. And if you like 5 vegetables, fantastic. Just cycle through those 5 vegetables. You don't need to eat everything under the sun. We just want the proportion of your vegetables to be the biggest part of your plate. So I've given examples here of it looks like collard greens, maybe a salad with onions, guacamole on top, and then also a salad with cucumbers and tomatoes, broccoli. And then down there, there's some more broccoli. It looks like cabbage, carrots, peas, radishes. So there's so many ways that you can get that food in there. It could be raw, it could be cooked, roasted, baked, broiled, whatever you like. We just need those vegetables in. And if you don't like eating vegetables by themselves, maybe it's a vegetable soup now during the colder months. The next part of our plate that we want to be mindful of is to include 25% of the plate being protein. The last part is 25% to be starch. So when we're following this template, you're doing a great job of getting those vitamins, nutrients, minerals that you need to reduce inflammation and reduce the chance that you may have any deficiencies. Now, the bottom left is my vegan example. So you notice there's no animal protein, but there's nuts, there's seeds, there's beans, there's legumes, mushrooms. All of those can be fantastic ways to get in the protein that you need, not from an animal source. And then, unfortunately, sometimes people that are vegan and also a very big subset of people with lupus may have low B12 and low vitamin D. So talk to your doctor. Get your levels tested, especially if you're very photosensitive and have been avoiding the sun a lot. You may need more vitamin D via supplement. So I want to pay attention I want to know if y'all are paying attention. So we're going to take a polling break. In the chat or in the poll, feel free to answer this question. What counts as starches and grains? What counts as proteins? And what counts as vegetables? If you already know these answers, that's easy peasy. Why don't you put in your favorite types of these things? So I will give everyone about 10 seconds to do so. And I look forward to those answers. Now, what counts as starches and grains versus proteins versus vegetables? Great job. Now, here are those examples. So when we've got our starches, that's usually a source of carbohydrate, the biggest source. It could be grains, fruits, starchy vegetables like corn and potatoes. Proteins, usually our source of protein, legumes, eggs, poultry, fish, meat, nuts, and seeds. And vegetables, those give us a little bit of carbohydrate depending on the vegetable, but also give us a lot of fiber. So leafy greens, cruciferous vegetables, carrots, squash, cucumbers, onions, and garlic. And we want some healthy fats in there too. So our avocado or olives, salmon, those all contain healthy fats. Our healthy nutrition. So when we're thinking about how to reduce our risk for cardiovascular disease, we want to focus on these things. So if any of you out there have high blood pressure, high cholesterol, or have a family history of heart disease, these are particularly relevant for you. We want to reduce our salt intake. We want to reduce our saturated fat intake. For example, red meats, processed meats, deep fried foods. These things are also linked with inflammation, increasing our inflammation. Avoid trans fats. So trans fat is a hydrogenated vegetable oil. If you see that on the ingredient list, put it back. It's probably not so great for us. Increase our intake of vegetables and fruits and increase our healthy fat intake. So more omega-3s, that avocado, avocado oil, olive oil, hemp seeds, chia seeds, ground flax seeds, salmon, sardines, tuna, anchovies, and herring. So those are all great sources of omega-3s. Now, when we talk about reducing salt intake, if you already prepare a lot of your foods at home, you probably aren't consuming that much salt. The vast majority of our sodium intake comes from processed foods. So that could be like, let's say, a bag of chips, a frozen TV dinner, anything that is in a can or a box or somewhat processed, long ingredients list may have extra sodium added to it, and that's going to be the majority of where you're getting your sodium from. For example, some of these fast food places or even fast casual places put tons of sodium in their food. From one meal, you could be getting from 1,000 to 2,500 milligrams of sodium. And the recommendation for your whole day is less than 2,000 milligrams of sodium. If you have very advanced kidney disease or a lot of problems and difficulty with your blood pressure, speak with your doctor. Some people do need to be on even a tighter sodium restriction, less than 1,500 milligrams per day. But that, again, is individualized with you and your doctor. So here's some heart-healthy choices in those examples. So we want to reduce our salt. It helps reduce our blood pressure, but especially if it's high. And it really helps reduce fluid retention. So if you're having problems with your kidneys because of your lupus, or if you're on high doses of steroids and you're noticing that you're retaining a lot of fluid, you're very puffy and swelling, reducing your sodium intake can help with that. Reduce our red or processed meats. It helps reduce our cholesterol. It helps reduce saturated fats, nitrates, nitrites. And so that would be like your bologna, your deli meats, anything canned. If we can step away from those, that's a really good step in the right direction. And then reduce our trans fat. And you see the examples here. It's mostly processed foods like snack foods, sometimes margarine, and if we can step away from that, that's also incredibly helpful for reducing our inflammation and reducing our cardiovascular disease risk. So what can we do instead? We can increase our fresh produce. So as unprocessed as possible is a great way to get more phytochemicals, antioxidants, fiber, vitamins, and minerals. We can choose higher fiber foods. So fiber is incredibly important for our gut microbiome. So when we include more high fiber foods, our gut microbiome is very happy. That can help reduce our inflammation and help with regular bowel movements and reducing bloating, constipation with time. Sometimes if you've gone from zero fiber to too much fiber, your digestive system may have a little bit of a trouble acclimating. So just increase your fiber slowly. And then omega-3s, that example again, are very anti-inflammatory. They help us feel full and satisfied after a meal, and they can help us reduce our body weight. Now we'll go into winter tips. So staying warm. If any of you put a little like hand raising emoji or me or yes into the chat if you have Raynaud's. So this is a side effect or a symptom that can be with lupus. Some people can have Raynaud's separate from lupus. So Raynaud's is when you have the difficulty of when your hands or feet get cold or have a temperature change. They might turn white or bright red or blue. This problem with their circulation and the ability to regulate can be very dangerous. Raynaud's can turn into something like ulcers on our fingers because of the problem with the circulation. So during the winter time, it is especially important to keep your hands warm. Cover them. Wear mittens or gloves at all times when you're out in cold temperatures. Keep a pair beside your freezer. So when you're picking through items and touching a bunch of frozen things, your fingers aren't feeling the effects of those. So you can keep your hands warm. Bring a pair to the grocery store when you're picking items from the refrigerated sections and the frozen sections. Consider investing in heated gloves or hand warmers if you're going to be outside for a long time or live in a particularly cold climate, especially like outdoor sporting events where, yes, you're having fun. Maybe you feel warm, but you're still out in the elements a long time. Or if you enjoy things like hiking or being out in nature, which is so great for you, we just want to keep your hands safe and your toes. Invest in reusable hand warmers. Worry about your core temperature too. So sometimes people with Raynaud's really focus on, okay, I'm going to cover my hands and make sure I have nice warm socks. But if you're not keeping your core temperature warm enough, you're going to feel cold all over, and that doesn't help either. So wear layers, certainly like a thin. There's all sorts of like kind of ski underclothes where it's a thin layer and it really keeps you warm that you could wear even under a work shirt, a blouse, a sweater that can really not add a lot of bulk, but help you feel really warm. Layer with sweaters, maybe a vest, a nice jacket. They make even heated jackets. Enjoy hot tea throughout the day if you work in a cold environment to keep your core temperature warm. And then keeping our feet warm. Obviously, heavy socks are a great start, but sometimes people double up those socks and that can impede our circulation even more. And that's dangerous. So we don't want to double up on the socks. Just invest in a pair of socks, one that's really warm. So wool or fuzzy, and a good pair of shoes too. Now, our general winter tips for your medical care. This is really, really important to discuss vaccinations with your doctors if it's the right choice for you. Flu, COVID, pneumonia vaccines are things that are generally recommended, but may not be appropriate for you. So talk to your doctor. Live vaccines are something that may not be recommended or recommended for you to avoid. Again, speak with your doctor. Changes in supplements or medications. So, for example, you may not need vitamin D supplementation during the summertime, but perhaps your doctor has noticed you always drop down after winter. That could be something to have a discussion about so that you don't have that drop in your vitamin D. And then, for example, allergy medications. Generally, people don't need them in the winter months, but need them with seasonal changes like fall and spring. And then increased infections can lead to increased flares. So try to avoid your overexposure to germs. Wash your hands, cover your cough, perhaps wear a face mask when you're going to be in a very populated area or around sick people if you work in healthcare. Now, our general holiday tips. I am always going to advocate for all of my people out there with autoimmune disease. So many of us feel the pressure to still do all of the same things that we did before our diagnosis, to still be that person that gets things done, maybe host Thanksgiving dinner, overextends themselves during the holiday season. I really want all of you to treat yourself with kid gloves. A chronic illness is not easy. It makes everything you do much harder, especially if you're having flares and symptoms. So please, please, please take the moment to really think about your November, December, even into January. Think about the commitments that are coming up and how many of those maybe feel like too much already, just thinking about it ahead of time. And please, please, please advocate for yourself. Prioritize yourself because your energy is finite. Obviously, with dietary changes and lifestyle changes, you may start to feel better, but please, overextending yourself can push you right back into feeling those symptoms again and the inflammation. So when we want to reduce stress, there's a lot of things we can do. One, acknowledge feelings. The holidays can be a hard time for feeling anxious, perhaps about finances, getting all the things done, feeling grief. Perhaps you've lost a family member or a loved one in the last year, and now you feel that grief of, oh, they won't be here for these really important family events. Disappointment that perhaps you're not feeling your best. There's a lot of feelings. So let's take the time to acknowledge those feelings. Let's take the time to journal, to speak with a friend, to speak with a therapist, so that we're really working through those feelings and not just burying them down. Prioritize your joy. There is, again, only so many weekends during the holiday season. There's only so many evenings that are available outside of work hours. Prioritize your joy. So if there are commitments that you feel like, I really don't want to do that, don't. Life is short. Unless you are required to do that, if there's some reason that you have to do it, Say no. It's okay. You do not need to be at all of these things. And in fact, getting the extra rest may help you actually enjoy the things that you're really excited about much, much more because you don't feel overdrawn, overwhelmed, and exhausted. So say no to those things that are really draining your energy. Take the time to prep and plan. So I understand that this season is full of surprises. Your schedule doesn't really shake out until kind of last minute sometimes. But as much as you can, take the time to prep some food ahead of time, prep some times that are allocated for you to rest. You likely are going to feel a lot better. Strategize. So if you have dietary restrictions, perhaps bring your own food to the potluck, eat a full meal ahead of an event in which you know that the food is going to be something that either you don't enjoy or that you know doesn't make you feel your best. Do less. So pare down the courses, the obligations, maybe have other people bring things so that it's a potluck style. Maybe get some catering for things, maybe get things that are a little bit more pre-made. So we oftentimes see these things on social media and start a little bit of comparisonitis of, oh my gosh, look, it was like a 10-course Thanksgiving dinner. We don't have to do these things. And in fact, you don't get a gold ribbon for overextending yourself. All you get is maybe a lupus flare and feeling really exhausted. So everyone can have fun and quality time and be in the moment and really still have a fantastic event that doesn't have all the extras and the bells and whistles. Ask for help. So ask your friends and family for help. And be realistic. So proactively think about what you can really do and try to get it to that level versus you've already started this 10-course giant thing or overwhelmed yourself with taking on maybe throwing a whole holiday party that you didn't really want to do. Be realistic about what you can do in your time, what's in your budget, what you're really excited about versus trying to do it all and not being able to do it. Don't overextend your budget. And then take time for self-care. So take your breaks, get your sleep, get some movement in, do some deep breathing. That helps a lot. And perhaps if meditation is something you're interested in, take advantage of that too. So I do want to say, let's take caution with these winter foods. So we want to be careful with very high fat foods, high salt foods. So those could be things that are, for example, really processed. Maybe it's those meats or cheeses that go on a charcuterie board and delicious to snack on, but are they really going to help you feel your best? Ultra processed foods. So those could be, for example, we just rounded out with Halloween. So maybe you have had a lot of candy around. I always think of those little dessert like cakes as something that's just super ultra processed. Anything shelf stable for years and years is probably not so great for us. So avoid those things because they really aren't giving you any nutrients as a boost. It's giving calories, maybe fat, salt, sugar, but it's not really helping so much. Excessive alcohol. So I put that picture on the left. I know this holiday season is often a time where people really enjoy. There's a lot of social drinking. However, it doesn't help us feel good. A lot of alcohol, being intoxicated, is a toxin. And you'll likely wake up the next morning really not feeling your best. So if you can reduce your alcohol intake, perhaps choose something like a wine instead of a hard liquor drink, a smaller portion, alternate an alcoholic drink with water so that you're slowing down your pace over the course of a celebration or a celebratory event. We also want to be careful with excessive sugar. I am not telling anyone out there, oh, you can't have any desserts this holiday season. I am not Scrooge. I'm not a terrible person, but let's not go overboard all the time. So Halloween just happened. Maybe he'll have a lot of candy around. Don't take on the idea of, well, it's a holiday season. I'm going to throw everything out the window. I'll figure it out in January because you will feel awful. Between now and then, it will not be that enjoyable. So please enjoy the things that bring you so much joy. Maybe it is your aunt's amazing pumpkin pie that she does once a year and it is so delicious. That's the thing to have. Enjoy it, savor it, take a mindful moment in eating it. But all of the little things that are around that maybe you just pick up because you're bored or it looks like, well, I could snack on something, I guess. Let's minimize those things. Now, I put here gluten, dairy, egg, soy. It depends on who you are. It depends on what sort of food triggers that you have. But if you have any of those things that bother you, let's minimize it. Please don't overdo it if you already know that it makes you feel worse. And this is also for a smaller subset of people. So nightshades include things like tomatoes, eggplant, peppers. Not everybody with lupus has any sort of sensitivity to nightshades, but some people do. So if you know that that family of foods, again, tomatoes, eggplant, peppers, spicy peppers, bell peppers, white potatoes, if you know that those things, ooh, yeah, I don't feel so great after I eat a lot of it, then just don't eat a lot of it. Maybe have a little bit here and there. Now, this is for everybody with lupus. Yellow number 5, or tartrazine, has been shown to increase lupus symptoms. Now, when we're eating something with artificial colors, it's not like we're eating tons of yellow number 5, but this is a pretty easy thing to avoid when we're also just being careful with processed foods and not eating too much processed foods. So that would be in like brightly colored candies. Sometimes, let's say it's a dessert and they're coloring it to be more bright. But they can also use it in all sorts of other foods. Sodas have it. So I wouldn't really recommend consuming it. And if you can avoid it, fantastic. There's no nutritional value in artificial coloring. So our alfalfa seeds and sprouts are the next one. These also have been shown to increase lupus flares and symptoms. So let's just avoid them. We don't need them. And last thing, artificial sweeteners. So they are known to not be great for our gut microbiome. They are known to increase our risk for diabetes, heart disease, weight gain. So if we can avoid those, I usually tell people just have a little bit of the real sugar and not an excessive amount. If you are the type of person that drinks diet drinks all day, uses stevia or Splenda in other drinks or in your baking, maybe try to just use regular sugar and consume less of it and see how it goes. So we're jumping into one of the things I do recommend. What can we eat more of? So cruciferous vegetables, go for it. It is seasonally appropriate. They taste delicious. They last a really long time. Broccoli, cauliflower, cabbage, Brussels sprouts, arugula, bok choy, collard greens, horseradish, kale, radishes, rutabaga, turnips. Ooh, watercress and wasabi. So there's so many ways to enjoy these season. They can be frozen, they can be fresh. They're colorful, they're bright, they're delicious. So you can serve them raw in a broccoli salad, maybe roast them, have them as a soup. You can ferment them, cabbage as kimchi or sauerkraut. You can put kale or one of the other vegetables into a smoothie. And honestly, you really don't taste it. You can saute it with eggs. And I'm from the South, so people here in the Southeast will sometimes make collard greens with smoked turkey. So that's just another example of greens and how we can include them. And here's a recipe. So easy oven roasted broccoli. And this is from budgetbites.com. So this one only has 4 ingredients: broccoli, olive oil, salt, and pepper. But if you want to spice it up with whatever seasonings that you like, fantastic. Please enjoy it. Make it something that you're excited about. Sometimes people like garlic. I will say some people are affected negatively by garlic, and some people eat garlic and feel totally fine with lupus. So that's up to you, and just check in with your body and see how you feel afterwards. But you could also put onions. You could put all sorts of seasonings, honestly. This could be like Italian broccoli with maybe rosemary, parsley, or oregano, or thyme, or cumin, turmeric. You can do anything with broccoli. So there's the other seasoning ideas: tarragon, onions, paprika, lemon juice. So don't hold back with only salt and pepper. Turmeric. So this one is Honestly, there's no season for it. You can just go crazy and include it all year long. But I included it because it's nice, this bright orange, very fall-like and winter-like color. You can add this to a lot of things like hot tea, a golden chai latte, for example, or a golden milk latte, in seasonings and curries and soups. Sometimes people just add it to make like a chicken dish or on their broccoli. And it's so beneficial for us. So it reduces IL-17, which is one of the things that becomes higher with lupus. It can help reduce our blood pressure, help reduce our protein in the urine, and reduce blood in the urine. So if lupus is affecting your kidneys, these are things that concern you, and turmeric can help. So here's an example of how you can include it. This is just with scrambled eggs. And granted, they're adding spinach. That's fantastic, and a little coconut milk. But it doesn't always have to be all of those other ingredients. You can just shake the turmeric over the eggs. Squash and pumpkins, definitely seasonally appropriate. They are packed with beta carotene, which is a precursor to vitamin A. They help reduce inflammation while boosting your immune system in a good way. They're great for eye health and wound healing. Roast them, blend them into soups, add them to smoothies, and that vitamin A can help reduce our autoimmune activity, and it's a very good antioxidant. And here's a recipe. So this is spaghetti squash with chickpeas and kale. Spaghetti squash is a very funny squash because you can roast it. So they preheat the oven to 400. They're roasting it. And then you just scrape it out with a fork and it turns into like almost little noodles, but it's squash. And apples, also seasonally appropriate. Our apples are like such a great fruit. They're so durable. They just last and wait for you to eat them versus berries that it feels like you have a 24-hour window to eat them. So they're a source of quercetin, and that is very helpful, very anti-inflammatory, antioxidant, antiviral activities. It can also help with lupus nephritis. So it can decrease the plasma levels of BUN and creatinine, which may be something that your rheumatologist tracking, improves our kidney tissue, reverses the expression of some inflammatory markers. And cinnamon, don't worry, there's a recipe coming up that combines these two. So cinnamon is really beneficial in rheumatoid arthritis. It can reduce these inflammatory serum levels, can lower our blood pressure, reduce our disease activity score, and in lupus may reduce our oxidative stress that causes inflammation. And here's a yummy recipe that you can include. So apple cinnamon baked oatmeal. And this one's great because you can do it all at once. And then you can scoop out a little square or a scoop and have breakfast for multiple days in a row. So your hard work has now given you lots of enjoyment. And look how many amazing spices are in this recipe. It would be delicious. And your ground flaxseed is a great source of the omega-3s. Same with the walnuts. So in summary, what are our helpful changes? One thing is actually a calorie restricted diet. So not overeating, which can be hard during the holiday season, but just do your best. Maybe take a small portion on the plate. If you really feel hungry after you've eaten your first plate, you're welcome to go back and get seconds. Focus on the things that really help us. So those vegetables, that's later on this list. But just not overdoing it. Certainly eating big portions can be a cause of acid reflux and discomfort and indigestion. Omega-3s. So we talked about that before, but those omega-3s are your salmon, anchovies, sardines, herring, hemp seeds, ground flax seeds, chia seeds, walnuts, avocado, olive oil. So there's lots of ways to get omega-3s, and they're very anti-inflammatory. High intake of unprocessed foods. So again, if it has a big long ingredient list, if it's a frozen meal, something like that, where there's a lot of ingredients, it's very processed, let's just take it down a notch. So for example, I always give this as like, here's our big spectrum of processing. So you have an apple. Then you have like maybe that apple oatmeal that I just shared the recipe for. Great, it's minimally processed because you know all the ingredients that are going in there versus like a little Debbie cake that's super processed. So if you can just take it down a notch in terms of the level of processing, you may find that you feel a lot better just with that change. More plants. So that's where we can add more vegetables. Also more beans, lentils, legumes. Those are helpful too. Quercetin, something like in apples, can be also really helpful. Cruciferous vegetables, so those are your broccoli. It's a big family, cauliflower, cabbage, so add more of those in. Promote our gut health, pre and probiotics, fiber. Then we've got turmeric and green tea, cinnamon and ginger. These are all excellent things that you can add in your diet and can make a really big improvement. Now, if all of this sounds incredibly overwhelming, please reach out. So I help people one-on-one with nutrition counseling, and I also have an amazing group program that starts next month called the Lupus Breakthrough Program. So in that program, I walk you step by step through all of the changes. We have a one-on-one meeting so I can personalize things to you. We have weekly group calls. So I'm here to support anyone that's excited and ready to make the changes to their diet so that you don't have to figure it out all on your own. So find me at my website, The Lupus Dietitian. My email address is there. So follow me on all of my social media sites. I am there. I'm available to answer questions, and I would absolutely love to help any of you figure out if diet and lifestyle changes, where to start. Thank you again to Lupus Northern California for having me. Everyone have a fantastic day, and I really hope that this was all super helpful. Take care. Thanks.